Good afternoon, everyone. Thank you for joining the webinar. We are just going to wait a couple more minutes for some other folks to join, and then we will go ahead and get started. Okay, we're going to go ahead and get started. So thank you again, everyone, for joining our MVP reporting with OncoEMR and MIPSpro webinar. We are looking forward to sharing a little bit about how we're working together for MVPs. My name is Mara Flaherty. I'm a partnership sales consultant here at Healthmonics. So that means I work with partner organizations such as Flatiron and then with their clients as well. I know I've worked with a number of you over the past couple of years to help you get set up with MIPSpro, and then I'm also joined by my colleague Philip Spence. So if you want to introduce yourself.
Yes, thanks, Mara. Hi, everyone. Philip Spence here, Strategic Partnership Manager for Healthmonics. I've also worked with a number of you all and work with Flatiron overall in our relationship between Healthmonics and Flatiron, and excited to share the information we have prepared for you today.
A couple housekeeping notes on the GoToWebinar widget. You'll be able to ask any questions throughout the webinar. You can just type them in the question section. And then in the handout portion, you can also download the webinar slides at any point. We will send out an email afterward with slides and the recording, but you can find them here and download them as well. And now we're just going to put up a quick poll question. If you wouldn't mind just submitting an answer for that, that would be great. Okay, so it looks like our responses are across the board a little bit. So definitely looking forward to share some additional information for those that are not familiar, and hopefully to those that are as well. Okay, so just a quick overview of what we're going to cover today. We will start very basic with what are MVPs, a quick overview there, and then we will go into a little further depth on the Advancing Cancer Care MVP specifically, and then lastly, reviewing how OncoEMR and MIPSpro work together to support MVPs this year. A little bit about Healthmonics for those who aren't familiar. We are a healthcare IT firm. We were founded back in 2007 by our current president and CEO, Lauren Patrick. We currently work with over 50,000 healthcare providers across the country, across various value-based care models like Mips and APP reporting, and we have cost analytics tools as well. And then a little fun fact, our providers on average score about 10 points higher than the national average on Mips reporting. And then additionally, a little bit about our partnership between Healthmonics and Flatiron. We've been partners since 2017, and our integration is set up to pool quality and promoting interoperability data into our MIPSpro dashboard on a weekly basis. And we work with over 70 Flatiron practices and over 1,000 providers each year on reporting. All right, jumping into the MVP reporting, 2023 is actually the first year that you'll be able to report through the MVP framework to CMS. MVPs are able to be reported by all of the clinician types that we're familiar with from traditional Mips, other than virtual groups. So that means individuals, single or multi-specialty groups, and APM entities are all eligible. And then CMS has also added a new participant type known as subgroups, which we'll discuss in further detail throughout the presentation here. For 2023, there are 5 new MVPs and 7 that have been revised for a total of 12. On a high level, MVPs are meant to align each MIPS performance category to a more cohesive measure set. You can see in this visual here that cost, quality, and improvement activities are all aligned on the same level, which then overlays the foundational level, consisting of promoting interoperability, population health measures, and also patient-reported outcome measures. So how are MVPs set up? They are set up to connect relevant measures across the 4 performance categories, which are, as we know, quality, cost, improvement activities, and promoting interoperability. And then MVPs also incorporate an additional set of administrative claims-based quality measures, most of which are focused on population health. As I mentioned, there are 12 distinct MVPs for 2023 whose measures align. Measures and activities both align with different specialties or medical conditions. And then for this audience, obviously the example here is the Advancing Cancer Care MVP, which will end up aligning closely with oncology groups serving cancer patients. MVP reporting categories are the same as traditional MIPS. So for the quality category in an MVP, you will be required to report on 4 measures rather than 6 like we're used to in traditional MIPS. Similar to MIPS, though, one of those must be a high priority or an outcome measure. And then for improvement activities, if you are a large practice, greater than 15 providers, this is a reduction in the number of required activities. If you're a small practice, 15 or fewer, this requirement is the same as traditional MIPS. So your options are to report 2 medium-weighted activity or 1 high-weighted activity, or participate in the recognized patient-centered medical home or comparable specialty practice. For cost, there are specific measures associated with each MVP, and similar to MIPS, your score will be assessed by CMS based on your claims data. So same as MIPS, you do not submit cost data through a registry, it's assessed by CMS. For each component of the foundational layer, as well as cost, the side note, a subgroup, which we'll get more into, will receive the overall group score. So CMS doesn't currently have a way of calculating these measures on the subgroup level. And then for the population health measures, groups must select one of the 2 available measures to report on. The score for that measure, for the quality or the population health measure, is then added to the quality score. And finally, every MVP participant will be scored on promoting interoperability in the exact same way as traditional MIPS. All right, eligibility and weighting criteria. So the same metrics for eligibility from traditional MIPS applies for MVP reporting. So as a refresher, that means a provider must bill over $90,000 in Medicare Part B, see over 200 Medicare patients, and account for more than 200 covered professional services to be required to report. And then in terms of category weighting, from CMS. An MVP participant will receive a final score based on the same performance category weights used in traditional MIPS, and the same performance category weight redistribution policies apply. Okay, so what is a subgroup? We've been hinting at subgroups a little bit. So as I mentioned, they are brand new for 2023 MVP reporting. Subgroups by CMS's definition are made up of at least 2 clinicians, at least one of which must be MIPS eligible for the reporting year. Only one subgroup is allowed per TIN/MPI combination. So in other words, no individual provider can be part of more than one subgroup for any given year. The point of subgroups is to allow providers maximize their scores, and that's done by collecting and reporting more meaningful measures and data relevant to these specialties. This also allows physicians and providers to compare themselves to peers in the same specialty more accurately. And the main target for subgroup reporting is really multi-specialty groups. In the year 2026 for CMS, multi-specialty groups will be required to form subgroups if they want to report MVPs. But before 2026, subgroups remain optional. Okay, so the process for registering with CMS to report a subgroup, report an MVP. Groups that do plan to report or track an MVP must register to do so via the QPP portal. And registration for that is open from April 3rd to November 30th of this year. Those participants who choose to report the CAPS for MIPS survey, however, do need to register for that by June 30th, which is next week. Subgroups do have a few additional registration requirements on top of these, which include a plain language list of TIN/MPIs, as well as a description of the composition of the subgroup. And then, as I mentioned, one provider can only be associated with one singular subgroup. And again, CMS finds that subgroups are providing added flexibility for multi-specialty groups. Okay, participation for subgroups. So subgroup participation for 2023 reporting year is limited to MVP or APP participants. So in other words, subgroups are not an option for traditional MIPS in 2023. Due to implementation challenges, also CMS is not allowing voluntary reporters, opt-in eligible clinicians, or virtual groups to participate in subgroups. And then in terms of eligibility, special status determinations and low volume threshold determinations are all going to be done at the group or TIN level, not at the subgroup level. So the actual subgroup does not have its own eligibility. It will adopt the eligibility at the TIN level. And that is determined, the eligibility is determined by the first MIPS determination period. And then of note as well, the subgroup score for administrative claims, PI, and cost is also adopted from the group score. They don't have a subgroup score. Okay, so this is a scoring example of a group that's reporting an MVP. One of the advantages that we have found of choosing to register and track data for an MVP is that it does give you the ability to choose your best score between individual, subgroup, or full group scores. So if you take this example of a 7-provider practice, we see that the full group is reporting on the Optimizing Chronic Disease Management MVP, and the full group is receiving a score of 90. The group also has 2 subgroups that are reporting separate MVPs. You'll see that subgroup number 1 is scoring an 80 and subgroup number 2 is scoring a 97. So in the bottom table, we see that those providers A, B, C, F, and G that are part of a subgroup will receive the best score between the full group score, the subgroup score, and their individual score. So if you take provider A, for example, on the bottom, you will see that they end up with their individual score that ends up being the best possible score of a 98 for them. But if you take a provider like G, who does not perform well individually, you see that they will benefit most from their subgroup score, and that is their best possible outcome. So all of this is really to say that MVPs and specifically subgroups are giving additional avenues to maximize the score for each provider in this situation. And then I'm going to turn it over to Phil to discuss the Advancing Cancer Care MVP.
All right, thanks, Mara. So as we as an audience here are focused on oncology care, we did want to take the time to share more about the Advancing Cancer Care MVP and what is included. So starting off with the quality category, there is a specific list of quality measures of which you can choose to report or submit to earn your quality score within the Advancing Cancer Care MVP. So as we mentioned earlier, you're selecting 4 quality measures and reporting on those 4 measures as opposed to in traditional MIPS, your 6 measures. You still need 1 to be an outcome or high priority measure. So that will impact as you're choosing which measures to submit, which measures are chosen. As you can see here, there is a wide set of measures that you can still select from. As we're going to show in a visual here in a little bit, this has been aligned with the measures that are available from OncoEMR and MIPSpro. I will call out that there are 2 measures on this list not supported by OncoEMR and MIPSpro together. That's 321, which is the CAPS for MIPS survey. That is a survey. You would need to engage a specific CAPS vendor in order to participate in that survey, and it is not something that Healthmonics engages in. And then the final measure on this list, which is a QCDR measure that's not supported by MIPSpro as well. The remaining measures you will have the opportunity to track performance in, and as again we get into how MVPs are done with OncoEMR and MIPSpro, you'll be able to look at performance across this measure set to determine which measures will give you the most advantageous score, whether that's for traditional MIPS or reporting in the Advancing Cancer Care MVP. For improvement activities, as we previously reviewed, you're looking to report on 2 medium-weighted improvement activities or 1 high-weighted improvement activity, or participate in a certified or recognized patient-centered medical home or comparable specialty practice. There is a specific list that we can see here of improvement activities that you need to choose from. As with traditional MIPS, you do want to keep in consideration the validation criteria for these activities, really what needs to be documented to prove that you have performed these activities, and you'll want to keep record of that validation criteria throughout the year or throughout the time frame in which you're completing an improvement activity. In the event of an audit, you would want to be able to provide that material back to CMS to make sure you receive credit for those improvement activities. For cost, there is 1 cost measure that is part of the Advancing Cancer Care MVP, and that is total per capita cost. So cost, like in traditional MIPS, is getting scored based on administrative claims data. So there's nothing that you need to submit in order to get scored in cost. For the TPCC measure specifically, you need at least 20 attributed patients to receive a score in this measure. So the best thing we can recommend here is going ahead and looking into your QPP site and comparing how you may have already done with the TPCC measure for 2022 performance year. As you may know, in the past, CMS has reweighted the cost category kind of across the board, but reaffirmed for 2022 scoring, of which the preliminary scores have been released by CMS, that the cost category will maintain its weighting if appropriate for practices. So we would recommend, if you're considering an MVP or even just to understand better what your performance has been for traditional MIPS, going ahead and logging into the QPP site seeing if you had attributed patients for the total per capita cost measure and what your score was for 2022 reporting in this measure. The foundational layer, as previously mentioned, part of which is the promoting interoperability, will be assessed in the same way as it is for traditional MIPS. You will report on the same set of promoting interoperability measures unless you have or qualify for a reweighting of measures or reweighting of the performance category. You can also receive a hardship exemption or exception if you apply and are approved for that hardship exception, allowing the category to be reweighted into other categories. So we list here the same set of promoting interoperability measures that you should be familiar with and are completing. And as mentioned previously, the PI measures are part of what is included within the integration between OncoEMR and MIPSpro. The additional foundational layer is population health. And as mentioned, you are required to select one population health measure when you register to report an MVP with CMS. So you will need to complete that process before the deadline later this year to register an MVP and or subgroup, or I should say, and a subgroup if applicable, and select between these two population health measures: the hospital-wide 30-day all-cause unplanned readmission rate for the merit-based incentive payment system groups, or clinician and clinician group risk standardized hospital admission rates for patients with multiple chronic conditions. Again, these are also calculated based on administrative claims. There's nothing additional you would need to do to submit data to be scored in these measures. And again, you're selecting one measure to get scored on for the population health measures. All right, so now let's talk a bit about how MVPs will work with MIPSpro and OncoEMR. So as many of you who have asked have heard, we are supporting MVPs in MIPSpro. This is a feature that has not yet been released. We are currently working on the addition of the workflows and sections of MIPSpro that will complete the process for MVPs. It will require the purchase of an additional license type, which will be made available when that portion of our product is updated to be available. And with the additional purchase, you'll then have another license that you can assign to your providers or practice to gain access to those additional workflows. For any who may not have used MIPSpro in the past, really the layout is as you see here. For setting up your quality category and similar for other performance categories, we have a checklist that you would go through, and we'll walk you through the steps for selecting your MVP, selecting which measures to show up on your dashboard, validating that you have elected to report an MVP with CMS, and that you have identified to CMS any subgroups. And we will ask for some of the similar information that you would need to register for a subgroup so we can validate that as well. With that workflow in MIPSpro, you will then have the ability to review performance and submit at the group level, individual level, for an MVP and for a subgroup. So when we are approaching MVPs and the inclusion of that reporting framework within MIPSpro, we see this as an opportunity to not just say we're doing MVPs and do an MVP. We want all participants in the MIPSpro MVP process to be able to assess performance at the group level, the individual level, MVP level, and if applicable at the subgroup level. This really provides the opportunity to assess, as Mara showed in that table earlier, which options for submission are going to give the most advantageous score. This additional workflow within MIPSpro is targeting for a late Q3 release. So as we continue to make those updates, we'll be communicating the availability of those additional licenses and provide steps to practices so that you can purchase the additional license and implement the MVPs within your MIPSpro dashboards. To elaborate further on the experience with MIPSpro and OncoEMR, as we mentioned, we're going to include those workflows. And really, what we find interesting is that the comparison of traditional MIPS and the quality measures within the MVP are going to align pretty well. We're going to continue to support the measures captured within OncoEMR and made available in traditional MIPS and the MVPs. So that comparison between traditional MIPS performance and MVP performance is going to be really important to understand which reporting framework will make the most sense and be the most advantageous for your practice. As we release those steps, again, it will provide a streamlined reporting process. We want to have these steps laid out such that if you didn't attend this webinar, you really have a good enough understanding through our process of what your requirements are to make sure you've taken the right steps with CMS, have assessed the appropriate performance in MIPSpro, and understand, like with all MIPSpro users, what your predicted score is prior to the submission of that data to CMS. With subgroup reporting, it is interesting to note as well, you do have flexibility in how you choose subgroups for this year. As Mara mentioned, the focus of subgroups is really on specialty practices, multi-specialty groups. So for 2023, CMS is very open with how practices align subgroups, but will be requiring specific segments or subsets of practices by specialty when we move into future reporting years starting in 2024. So we'll continue to update our system to validate against those requirements and make sure that any predicted score you're seeing in MIPSpro is going to align with your expected score from CMS once you submit. So that additional validation of reporting requirements. So you're a little less responsible, certainly still responsible, a little less responsible for all of those requirements, and we can help support you by presenting those to you within our process. And again, the intent for supporting MVPs is not just to be able to support an MVP, but to understand for each available reporting framework what your predicted score will be and allow you to maximize performance, whether that's through submission in one reporting framework or across multiple frameworks. I also wanted to share here the different measures that are available, both in the MVP, Advancing Cancer Care MVP, and for traditional MIPS. So for those of you who have used OncoEMR and MIPSpro for your MIPS submissions in past years, or have already gotten started for 2023, which many of you have, you know that we collectively have expanded the available quality measure list for 2023 reporting. So OncoEMR has done a great job of adding the workflows and tools within their system to be able to capture either additional information or at least to make sure that information is being sent over to MIPSpro such that we can provide the quality performance dashboards for the additional measures that are included within the MVP. So I'd like to call out that as you're considering whether it will be beneficial to add MVPs to your MIPSpro experience, that if you're using traditional MIPS, you'll still get to see and access the same set of measures because we are adding the new measures for the OncoEMR MIPSpro partnership to traditional MIPS reporting. So for those of you already signed up for MIPSpro for this year and using the integration with Flatiron and OncoEMR, you will already be able to see performance in many of these measures. If there's not performance in any, those will be added shortly and have the full scope of performance within this measure set. And if you choose down the line when it becomes available to add the MVP license to your MIPSpro account, then you'll be able to just see the segmented measures within the Advancing Cancer Care MVP within your MVP view. And just to reiterate, with the addition of the MVP license, you'll be able to then compare performance in the MVP measures, so that's going to be the shorter list of available measures, and understand your score based on your top 4 measures, and then switch over to traditional MIPS reporting and see what your performance is in all measures that are supported by OncoEMR and MIPSpro and your top 6 measures. And of course, we're talking about how the product will look. We'll certainly provide screenshots and information that you can review at a later date when all of that becomes available. All right, so I'm going to turn it back over to Mara to discuss what you need to do now.
Sounds good. Thanks, Bill. All right, so how to determine if MVPs are going to be right for your practice? There are a number of different reasons that practices may consider moving towards MVP reporting or away from traditional MIPS. One example might be if historically, if your practice has had trouble finding 6 applicable quality measures in traditional MIPS, or if you're unable to meet the data completeness criteria for any number of your 6 measures. In that case, reporting on 4 quality measures in the MVP rather than 6 might make sense for you. Another reason, which we've already discussed a little bit, is that you want to take advantage of better scoring opportunities. So in other words, comparing the different frameworks, so traditional MIPS versus MVPs, and on the individual group and subgroup levels. Another reason you may want to prepare for the phasing out of traditional MIPS, you might want to become familiar with the MVP reporting process before that comes mandatory in the future. And then lastly, multi-specialty groups that would divide neatly into subgroups who can report on separate MVPs are going to be a good candidate for MVP reporting. So of course, each practice will have different considerations when determining whether MVPs are the best option. But here we've listed some of the benefits that we've found so far. And as I did discuss in the scoring example, CMS is going to give you the best score between individual group and subgroup. We also see this as an opportunity to familiarize yourself with MVPs in more of a low risk, low stakes environment before they are mandatory in the future. And then on the same note, subgroups will also be a required aspect of MVPs by 2026. So this is a good time to determine how your practice can most efficiently be broken into subgroups and how to make the best use of that subgroups before they are also mandatory. And then last thing, MVP reporting does give you the opportunity to focus on 4 quality measures rather than 6, and most likely the 4 are going to be more relevant to your specialties and subspecialties. Okay, so quick review of a few key dates that Healthmonics likes to highlight throughout the year and leading up to submission season. We recommend having your practice profile completed shortly after your purchase, so within 30 days is normally good. I know that most groups have already probably completed that, which is great. And then once your practice is set up, we do encourage you to complete your first performance review within about a 90-day period after that. So that means logging into MIPSpro to take a look at your data that's coming over from OncoEMR. Just make sure that it looks correct and complete. And then after the end of the performance period, submission will open on January 2nd of next year. We recommend completing your final performance review by January 15th so that you can submit by February 15th, which is our recommended submission deadline for MIPSpro. We recommend submitting early so that you can review and make any changes needed. But April 1st of 2024 will be the final day that CMS accepts any submissions. I know everyone probably is familiar, it's normally March 31st, but it falls on a Sunday this year. So April 1st is the date. And just another quick note, I know a lot of folks have already signed up for their 2023 MIPSpro licenses, which is great. We do just want to make everyone aware that the MVP aspect of it can be added on at any point. So if it's still something you're considering and you've already gotten set up for 23 and collecting data, that's no big deal. We can still help you get set up with the MVPs throughout the year as well. You just want to keep in mind that November 30th deadline to register for MVP reporting. So for more information about MIPS in general, or specifically MVP reporting with MIPSpro and OncoEMR, here are the different ways you can reach us. That email address goes to Bill and I, the sales team at Healthmonics, and then that is our phone and extension. And then lastly, that hyperlink is a landing page where you can fill out some information for us to follow up with you. And that is all we have, and we are going to open it up for questions now.
All right, so just reviewing some of the questions that have been asked, we're going to address some of those. Please feel free to add additional questions to the GoToWebinar tool, and we'll respond to those as well. So one of the questions was, why would one do an MVP versus just MIPS, and what are the advantages? I know we covered some of this, but I think the biggest point we can share is that in addition to aligning better with MVPs, potentially aligning with subgroups, and preparing to move into the reporting framework that will be required in the future, there can be advantages based on your scoring within your quality measures specifically. We call that out because the difference between 4 and 6 measures. If you've got a top 4 measures that are greatly above what you might score with 6 measures, then it may make sense to report those 4 measures through an MVP and then receive that scoring. One of the challenges with trying to determine which is going to be most advantageous is you have additional differences, such as the inclusion of the population-based measure choice. So which of those are you going to choose, which we'll come back to in a moment. And then also the limitation of just being scored on the TPCC cost measure. So I think, one assessment you could do is look at that 2022 score that you've received, look at how you may be performing right now, and think about if that would be different based on what cost measures you might be excluded from by participating in an MVP, in the Advancing Cancer Care MVP, or if there would be a higher scoring opportunity by submitting on fewer measures. I think overall, I'd also like to point out that it's not going to be an exact science without really looking into what those predicted scores are going to be. So that's where we do see the advantage of adding the the MVP license to your MIPSpro account, so you can go ahead and compare and see what the predicted score would be. If you're not using our cost product, that cost category is going to be a little bit of an unknown. If you are using our cost product, you also know that that is predictive, but it's based on prior year data, so it's not going to show you the exact score that you might receive. So that's going to be a challenge across the board for everyone. And we do encourage folks to be familiar with the cost category and how that might impact you. But overall, just know that we feel the best way to anticipate which reporting will be most advantageous will be to have all options in front of you. To piggyback off of that, we did receive a question related to the population-based measures. How would you know which measure is best? And I think that's based on the criteria for the measures themselves. We did not go into detail, but CMS does have on the QPP site and within the resources the measure specifications for each of those population health measures. So we would recommend taking a look at those, seeing if there are details that may help you understand what your scoring might be in those measures, and give you some semblance of a direction on which may be the most advantageous for you. Another question I believe we answered, but we'll reiterate here. Will there be additional setup required if we've already purchased the MVP add-on? There is going to be a setup process. So when that license is made available and added, And of course, we're tracking who's purchased those additional MVP licenses. We will then activate within MIPSpro an additional workflow, which will include selecting the MVP, selecting the measures for the MVP, selecting any particular potential subgroups you may add, and the segmentation of which providers will be included within that subgroup. So once that license is added in MIPSpro, there will be additional setup steps within MIPSpro. All right, so just reviewing some additional questions here. We did get some comment about pricing. We'll go ahead and follow up with practices directly on pricing so you have an understanding of what that might look like for your particular practices. All right, so we also did have a question related to tracking performance and scoring at the individual level. We are going to get back with a little more detailed answer directly, but for some practices, particularly those with a large group of providers, if you are looking to track performance and scoring at the individual level, there are some steps you can take to do that prior to submission, but we do also have some opportunities to provide additional scoring, really tracking throughout the year that we can discuss as some additional add-on opportunities within your account. We will reach out directly to discuss that at a little more granular level. So as we wait for any additional questions that might come in, we just want to reiterate that we will be sending out the webinar slides and webinar recording after this webinar is complete. You can access the slides now within the GoToWebinar widget and save those to your computers. And then as we do make available that additional MVP license, we will be able to share more material, including a look at what those dashboards and workflow within MIPSpro will look like. All right, well, barring no further questions, we really appreciate the time to share this information with you all. If you do have questions that come up after the webinar, please feel free to reach out to us. You have the contact information there, and you likely already have contact for either Mara or I, and we'd be happy to discuss more specifically for your practice, what the experience would be like, or any other considerations for your participation in an MVP. We just want to thank you all again for joining us and thank the Flatiron team for their consistent partnership in offering what we feel is a really beneficial process for supporting MIPS in a way that allows you all to do what you do best, which is provide care to your patients. So with that, we thank you once again and look forward to being in touch.